Town of North Hempstead Supervisor Judi Bosworth recently spent some time at Winthrop University Hospital's Institute for Cancer Care, a Category 1 cancer center, to meet with some of the hospital's leading cancer care specialists and to observe some of the state-of-the-art technology located right here in the town of North Hempstead. Winthrop University Hospital, located in Mineola, is a 591-bed, university-affiliated medical center and New York State designated regional trauma center. The hospital is a major regional healthcare resource with a deep commitment to medical education and research, offering a full complement of inpatient and outpatient services. The hospital employs 6,000 individuals, including nearly 1,500 nurses and 1,525 full-time and voluntary attending medical staff. Supervisor Bosworth first met with Dr. Eva Chalice, the Chief of Gynecological Oncology and Director of Clinical Cancer Services, and the two discussed Winthrop's cancer program.
Dr. Chalice, I'm so pleased to be here, and I appreciate so much your taking the time to tell me and all those who will be listening to this about Winthrop Hospital.
Thank you for having us.
Yeah, it's kind of exciting, and you know, there have been so many incidences of cancer in Nassau County on Long Island, and we understand that, you know, Winthrop's Cancer Center is something that's really been growing and developing. So just like to know, in your opinion, you know, what's unique about Winthrop's Cancer Center?
I think most cancer centers have a lot to offer to every individual. What is unique about us is some of the firsts that we've introduced on Long Island. One of the firsts that we're very proud of is the Nurse Navigator program that we incorporated into our multidisciplinary approach.
So what's that?
That means that multiple physicians and various healthcare providers are involved in helping design the care of the patient, as well as making sure that they're successfully navigate through the maze of having to get tests and treatments scheduled, and they don't have to juggle and feel overwhelmed, both they and their families or loved ones.
Well, so interesting that you say that, because we know when someone gets a diagnosis of cancer, you know, we know there have been so many amazing inroads and new therapies and treatments, but yet it's still kind of devastating when you get that diagnosis, and it really does. It affects certainly the person who's getting the diagnosis, but of course their families as well. So, you know, it's great to hear that all of that is taken into account as you develop a treatment plan.
Yes, I think there's no question that although successes in cancer treatment are well known now, and we continue to see improvement in outcomes for cancer patients, it's still a potentially life-threatening diagnosis, and it's understandable that both patients and their families would be overwhelmed with what needs to be done, especially since many of the treatments now are really a combination of treatments. It's not just one type of treatment, for example, just surgery. It's very often surgery and chemotherapy and radiation. And it gets to be a bit much for everyone. So it's nice to know that you have a team. And I always tell patients you sort of have a village standing behind you. It really does take a village to get people through the treatments. And obviously that village doesn't end at the hospital. It extends into the community.
So it's great to hear about this interdisciplinary care and the fact that the patient and their family are so well taken care of. But what else is unique about the treatment here? What's innovative about the approach?
I think one of the things that is very important is adaptation of technology at an appropriate pace. And so some technologies like CyberKnife we've adopted quickly and really have the greatest expertise in the region. And in fact, I believe our CyberKnife program for prostate is #2 in the entire world in terms of volume.
I actually have seen it advertised, so you're also doing a great job at marketing it.
And I think making the public aware that they have a gem in their backyard. Other technologies like robotic surgery we've adopted a little more slowly, but have also used it in a more extensive manner in that multiple services utilize the robotic surgery. We've been very disciplined in approaching this so that the patient outcomes can be the best they could possibly be, and that's very precise, safe surgery with excellent outcomes. And in fact, we just began being the first ones operating on Long Island on the new XI system, which is even more innovative than the previous systems have been. So we're very proud of those kind of advances.
So it sounds like the patients here are getting wonderful care. But how will people who are diagnosed with cancer know that they're getting the best possible care?
I think if you look at our performance across the board, we have excellent outcomes. We have expert physicians. We have large teams of oncology nurses, nurse practitioners, physician's assistants. We have nutritionists, social workers. We have psychosocial support. We have financial assistance, and those are all clinical things. But I think one of the ways that one can measure excellence is participation in research trials. We have some of the most innovative research going on in a number of areas, including specific research in immunotherapy, where basically your immune system is taught how to recognize cancer cells and help destroy them. And we also have specifically designed treatments for patients where the physicians look for weaknesses in the cancer cells to basically capitalize on the fact that the cells cannot fight against a specific agent, and we can design the best form of therapy for that patient. So we believe that we provide really everything patients need. But having said that, there is no cancer center that I'm aware of that has access to everything in the world. And so when we are in a position where we believe that the patient would be better served being elsewhere, we actually look for research trials for them, and if appropriate, we'll help facilitate their transfer to other places, sending patients to National Cancer Institute or one of the national cancer centers. And so I believe that the patients are treated the way you would want to treat a family member.
Before you said it takes a village, and it sounds like that village is right here in Winthrop Hospital, in Mineola, in the town of North Hempstead, and we just so appreciate you taking the time to speak, with me and the people who are going to be viewing this, to hear about some of the wonderfully innovative approaches to the whole gestalt of someone who's diagnosed with cancer, and so that they know that they will receive just such wonderful care and treatment here.
Thank you so much for saying that. We, I think, we live in the community. We want the patients here to get the best of care the same way as we would want it for ourselves.
Absolutely.
Thank
you
you.
so much.
Pleasure.
It's a pleasure.
Thank you.
Following her meeting with Dr. Chalice, Supervisor Bosworth visited with Dr. Jonathan Haas, Chief of Radiation Oncology at Winthrop. Dr. Haas showed the supervisor the CyberKnife, a new form of technology that treats cancer patients with stereotactic body radiation therapy. Dr. Haas called the CyberKnife the greatest advance in radiation oncology in the last decade. The CyberKnife is used to treat many forms of cancers, such as prostate cancer, with sub-millimeter accuracy, allowing doctors access to previously unreachable and untreatable tumors throughout the body when radiation is needed. The beams stay focused on the tumor and minimize radiation to surrounding healthy tissue. The Radiation Oncology Department is also home to the Varian TrueBeam, or Image-Guided Radiation Therapy, a technology which enables the patient to be imaged prior to each treatment, with adjustments being made to ensure that each treatment is available to within millimeters. This is the most advanced conventional linear accelerator available to treat radiation oncology patients. Supervisor Bosworth then headed up to the second floor for a look at the interventional radiology department, where Dr. Man Han, Vice Chairman of Clinical Affairs and Chief of Interventional Radiology, and his colleague, Dr. Jason Hoffman, both work with cancer patients.
So we met with Dr. Haas, who showed us about the CyberKnife technology. It's really quite extraordinary. But I understand you do interventional radiology.
Yes.
So could you tell us, what is interventional radiology?
Okay, so interventional radiology, with doctors who basically perform minimally invasive procedures using image guidance. Okay, so we'll basically use X-rays, ultrasound, or CAT scan, or MR, and we'll use that imaging to go into the body through little tiny holes and do procedures. So we'll put in needles or catheters or tubes, basically anywhere in the body, to do various procedures.
With this technology, we can deliver very high doses of radiation directly in and around tumors, which can't be done necessarily externally. So it's a nice supplement to some of the other therapies that we have in terms of CyberKnife, chemotherapy, all these other different things we can do. This is a very unique way to deliver radiation into tumors.
In the Winthrop University Hospital Infusion Center, located a short walk from the main hospital, Dr. Harry Stazuski, Chief of Oncology Hematology, explained to the supervisor the kinds of treatments given at the new state-of-the-art facility.
Sure, this is a facility that was built almost 2 years now, in the end of December 2012. And we administer almost 16,000 treatments a year. And this is a very comfortable state-of-the-art facility with on-site laboratory, pharmacy, so that we offer the safest environment in order to administer the newest treatments for cancer. We can give outpatient transfusions, we can give hydrations, we can give immunologic therapies for some of the other diseases in multiple sclerosis, for example, that require long infusions in a comfortable, safe area that's staffed by very experienced nurses and physician's assistants, as well as physicians, to make sure that the patients have a great environment to receive their treatment.
Patients receive advanced cancer treatments from the center's highly trained and caring staff. Because patients being treated at the infusion may spend hours receiving their treatments, the center offers private space for the patient, as well as internet access and a TV to make the stay as pleasant as possible. Maggie Lane is a registered nurse and the nurse manager at the center.
So how many patients does each nurse take care of in a typical day or a typical shift?
Each nurse has 6 to 7 patients a day, depending on the acuity of the patient. We pretty much practice primary care here, where the nurse does everything for the patient from the time they register to the time they come in. They draw their blood, they give them the medications, and they take care of them from start to finish.
So if someone's coming here, let's say several days in a row, they have the same nurse or?
No, we don't do that here. We feel that it's better for the whole staff to know all the patients, because if you do it that way, in our opinion, then if the patient comes on a day that the nurse is off or on vacation, they feel a little out of sorts. So we feel it's better for all the nurses to know all our patients.
That's wonderful philosophy.
Yes, yes, it works for us.
Yeah, great.
Following the visit to the infusion center, the supervisor had the pleasure of honoring 2 of Winthrop University Hospital's volunteers. These volunteers play an extremely important role at Winthrop Hospital, as they selflessly give of their time, skills, and compassion in a variety of ways. Vivian Frish of East Williston was one of those volunteers. Vivian began by volunteering at Winthrop University Hospital in 2008, and since that time, she has served more than 700 hours, working as the hospital's liaison to the American Cancer Society. Vivian's dedication, compassion, and concern towards Winthrop's patients and families is the common thread that runs through everything she does. Her giving spirit and kind nature make her indispensable to patients and their families. Volunteer Robert Gordon is from Westbury and began by volunteering at Winthrop University Hospital in 2005. Since that time, he has served more than 1,000 hours, working with his wife Patricia in the hospital's Child Life program. The program is dedicated to helping children take their minds off of being in the hospital. Robert and his wife focus their efforts on this program to honor the legacy of their daughter, who they tragically lost to cancer at the age of 23. Robert spends time visiting with patients and distributing toys in the Child Life Activity Center in the hospital's Hagedorn Pediatric Inpatient Center. He also visits patients who are unable to leave their rooms to ensure their requests for toys or games are met. It was an honor for the supervisor to present these dedicated volunteers with a proclamation from the town, and also a wonderful experience to meet the highly trained, caring, and committed staff members of Winthrop University Hospital.